Galfrey, AHS Vice President and Medical Director for Northern Alberta. As you know, Dr. Hinshaw will be delivering remarks via video streaming. We've taken steps to ensure that audio and VR is as clear as possible. However, if there are any issues, please let us know after the event and we'll make sure we address them moving forward. Now, as always, Dr. Hinshaw's expertise is Alberta's health response, and we're happy to address any questions, either from her as well as our speakers in the room. We know COVID-19 is bigger than just health, and so if there are other questions, we have Paul Winnick, Deputy Minister of Municipal Affairs, who can help answer those questions. But if there's anything else, let us know, and we'll make sure to connect you with the right person offline. Also with us today is our sign language interpreter. We recognize the unique needs of Alberta's deaf community and thank the Albertans who have brought this to our attention. I will now turn this over to Dr. Deena Hinshaw.
Great, thank you, Tom, and thank you everyone for coming today, despite the slightly unusual nature. And I just want to thank the team that's helped set this up by video. As you can see, and as has been reported, I'm currently self-isolating. I felt well yesterday, but woke up with a sore throat. And although my symptoms are mild, it is important to underline that no one is exempt from staying at home, even when they have mild symptoms. I would like to thank all those who have reached out to me and expressed well wishes. I really appreciate it. And as you can see, I am feeling okay. I just have this sore throat. My symptoms do not appear to be consistent with what is typically seen with COVID-19. I do not have a cough or a fever. Despite this, as I have consistently said in these updates, if you are not feeling well, stay home, self-isolate. We cannot risk exposing our coworkers and neighbors if we are sick. This is what our new normal looks like. Earlier today, I was tested for COVID-19 at the request of senior leaders to ensure that I am able to return to work in person as soon as possible and not to have to wait 14 days, as would be if I did not have a test. While I wait for these results, I continue to self-isolate. As I said yesterday, you don't need to wait for a lab result to do what's right. Stay home if you're sick. I want to reassure Albertans that I continue to perform my duties as Chief Medical Officer of Health while I self-isolate. I continue to participate on conference calls, receive regular updates and briefings throughout the day. And I will continue to update Albertans through these media opportunities. As I have repeatedly said, this is our new normal. We must adapt and find creative solutions. While I know it is not possible for everyone, the ability to work from home is going to become more important for those in occupations where this is possible. I would also like to take a minute to talk about self-isolation, particularly actions that I have taken to reduce the risk to my family members. I'm fortunate to be able to have a spare bedroom where I can self-isolate with my own bathroom. I am not eating meals with my family, and I am staying 2 meters away from others in my household. Even though my symptoms are mild, I believe it is important to follow the advice I have been providing to others over the last several weeks, as this is another part of our new normal. Even without a lab test, these steps are important to take proactively. With respect to our current situation in Alberta, over the last 24 hours, we have confirmed 18 new cases of COVID-19. This means that 74 cases have now been identified in the province. For the first time, we now have confirmed cases in every health zone in Alberta, with 1 case each being confirmed in North and South zones today. This pandemic will impact all Albertans, no matter where they reside in the province. All Albertans need to come together and do our part to help stop the spread of COVID-19. Currently, 5 individuals are receiving treatment in hospital and are in stable condition. All other confirmed cases are self-isolating at home and expected to make a full recovery. As always, health officials have taken swift action to isolate the new cases and any close contacts who may be at risk. As mentioned yesterday, we believe that 2 cases are the result of community transmission. Community transmission is when a person catches the virus from someone who has no traceable travel connections. This could mean that Albertans are exposed within their communities. As announced yesterday, in response to the increased potential of community transmission, we took additional action. I believe these were necessary actions to help slow the virus and protect public health. Today is the first day of cancelled classes in schools. I know this decision is going to impact parents for the days and weeks ahead as we all find childcare solutions. To be clear, we did not close schools. Teachers and other school staff should continue to come to their schools to plan potential alternatives for students, particularly those in grade 12. Yesterday, we also announced that all licensed childcare facilities, out-of-school care programs, and preschools were to close immediately. I know many parents are looking for childcare arrangements such as private childcare providers. While these groups are able to remain open, these unlicensed day homes can only care for up to 6 children, not including their own, at any one time. These arrangements are not monitored by the province, and I encourage parents to seek out information to make informed decisions. While grandparents and other seniors are a great help with childcare, I would encourage limiting their exposure to children who have any signs of illness, even mild illness. Older Albertans are at an increased risk of having complications if they were to get COVID-19. Parents should also take precautions and limit the number of playdates to reduce the chances of community transfer of any virus. Parents should ensure that whether they are having friends or family care for their children, or they're attending a day home, hand washing facilities or hand sanitizer must be available to children and visitors with reminders to wash their hands frequently. Any day homes, approved or private, should routinely clean and disinfect surfaces that people regularly touch, like toys, door handles, keyboards, toilets, and tables. They should also advise visitors and children not to enter if they are feeling unwell. All have a role to play in the days ahead. We have more information to help you plan at alberta.ca/COVID-19. I encourage you to visit this site to receive the latest information available as we do update it daily. And today I added a Twitter account, CMOH_Alberta, to the tools I am using to share information with Albertans. I know the situation can be overwhelming and create anxiety as we watch the global effort to prevent the spread of COVID-19. We as Albertans and Canadians must come together and support one another. We must continue to be compassionate and do what we can to help one another. I'm hearing from Canadian Blood Services that they are seeing a decline in blood donations. The need for blood donors remains strong. It is safe to donate blood during COVID-19. Your donation can help save a life. As we work to contain COVID-19 and keep the public informed on the situation, we should also think of those who are battling their own health issues unrelated to COVID-19. Blood donation can help address the feeling of helplessness people have in the face of COVID-19. Gaining a sense of control by helping others can help contribute to an overall sense of well-being. The health of Albertans is and always will be our top priority. We will get through this together. Thank you, and I'm happy to take any questions you may have.
All right, we are going to obviously in a unique situation, so we'll ask you to do one at a time, and please speak loudly and clearly so Dr. Hinshaw can hear you. We'll start with Julia.
Hi, Dr. Hinshaw. The City of Toronto announced that restaurants and bars should be shutting down. We're seeing this happening in New York City and other major cities. I know I asked you this yesterday, but are we getting close to that point, and what is the threshold for that?
So we talked yesterday about the important shift that happened over the weekend with community transmission in Alberta. And so we continue to closely monitor the cases. So far, of the new cases announced today, I don't have an update with respect to whether or not any of those are community transmission. I do know that the majority that have been reported to me did have a travel connection. So while the numbers again remain high every day, it's a reminder that our system is finding those travel-related cases to prevent any further spread in the community. Having said that, I am concerned about that potential for community spread. And so certainly continue to discuss these topics and whether or not any additional measures are needed with our cabinet. And we continue to take the situation very seriously and are talking with other provinces and territories. So again, every day we have these discussions and determine whether or not additional measures are needed. And as they're needed, we will take measures to protect the health of Albertans.
All right, Rafi?
Yes, hi, Dr. Hinshaw. I had a couple of questions for you. The first being that yesterday night we saw Premier Kenny tweet that additional provincial resources would be deployed to the two airports. It looked to be connected to screening. I know the Premier's not in the room today, but I was told there'd be an update on that this afternoon, and I was just wondering if you knew anything about it.
I believe actually.
Sure. So maybe I'll speak to that briefly, and then I think maybe Deputy Minister Winnick would be able to answer the details about that. So I'll just say that we've been working with our partners in health to make sure that we get accurate information about Alberta's requirements into those airports. And then maybe I'll ask Deputy Minister Winnick if he can comment with respect to the Provincial Operations Centre and some of the work that they've undertaken on this topic.
Thank you, Dr. Hinshaw. Yes, at this point, we're coordinating with Calgary International Airport, Edmonton International Airport, and the smaller airports to ensure that all arriving travelers, as Dr. Hinshaw has said, are thoroughly aware of the current state of events in Alberta, the restrictions that Dr. Hinshaw has talked about, and are thoroughly briefed on what's actually happening in Alberta. So in terms of the actual resources we're deploying forward, I can tell you one of the things that's being worked on right now is actually an Alberta-specific pamphlet that will be handed out to all travelers and ensuring that nobody is missed. I can't tell you what that means in terms of personnel resources. We're looking at that right now. But the aim is to ensure that there is absolutely no gap between what people are being told when they go through CBSA and what is required here in the province of Alberta.
Dylan Short, Post Media. It's kind of related, but in regards to traveling within Canada or even within Alberta, is there any restrictions or even recommendations at this time? Like, is it safe to travel from Edmonton to Vancouver at this time?
So we know that there has been some local transmission in Vancouver. Having said that, again, we do have some cases of local transmission in Edmonton and Calgary. At the moment, we don't have any active travel recommendations restricting travel within the country. What I would advise Albertans is to consider wherever they go at this time, the more people they're in contact with and the more gatherings they're a part of, the higher there is for a potential for coming into contact with the virus. So those are the kinds of things to consider when making plans. Again, no active travel advisory, but just a recommendation that to limit exposure, the best way to do that is to be around as few people as possible.
We'll now go to the phone, and then we'll come back. I know there's several in the room. Operator, could you patch one through?
Our first caller comes from James Keller of the Globe and Mail. Your line is open.
Hi there. Could you comment on the federal announcement today in terms of closing the borders to most travelers and also rerouting international flights to several airports, including Calgary? What do you think about that? And does that second part about international flights being diverted here pose an additional risk to Alberta?
So I think from my perspective, the federal government has taken these additional measures to emphasize the seriousness of the situation. With respect to the impact of those, I think that remains to be seen. Certainly having targeted airports where international flights come does help to make sure that any international flights arriving, the resources are focused on those locations and people can be sure to get the information that they need. But we need to remain vigilant for what unintended consequences may be. So we will continue to watch closely and participate again in federal, provincial, territorial discussions and make sure that going forward we continue to adjust our approach based on emerging evidence. And again, just underlines the seriousness of this particular situation, this unprecedented move to limit our border travel.
And I think there are several government officials who also can provide you more information. She's coming from the health lens. Operator, could you patch through the next question?
The next question comes from Tara Weber of BNN. Your line is open.
Hi there. I'm still interested in this community transmission event that happened in Calgary. Do we know the size of the event and when it took place or any other details?
So the information that I have, I don't have the date, unfortunately, but I do know that there were approximately 40 people gathered in a home and that the source of the infection was someone who traveled from outside the country. And there was then transmission at that event. So that's the extent of the information that I have. I think, again, it underlines that when you have lots of people in close contact, particularly with people who are traveling from outside of the country, that raises the risk. And again, I really underline that even if someone only has mild symptoms, they should not be around other people. This is really the foundational piece of something that Albertans should be thinking about is if they themselves have mild symptoms, they should stay home. And if somebody that they're around has mild symptoms, they should stay 2 meters or more away from them and make sure that they're regularly washing hands because even, again, someone with mild symptoms can potentially transmit.
Excellent. We'll come back to the room. Dean?
You mentioned you're closely monitoring the restaurants and bars. Does that apply to casinos as well then, or what do you plan to do with casinos?
So again, I don't think that any of these locations have fairly similar dynamics with respect to having larger numbers of people who are gathering together. So I don't anticipate that any decisions would be made about any of those individually. Again, we're monitoring the situation. We're using the evidence of what we know about the spread of this virus and the challenges posed by some of these settings where there's lots of people together. So again, no decisions have been made at this time. It's simply a matter of monitoring and looking at all the different settings that there may be a risk of transmission.
AGLC may also have some more information if you need. Yeah, over to you, Julia.
Sorry, one second.
Sure. Yeah.
Oh, okay. California, Quebec, a few other jurisdictions are now asking their seniors to stay at home. What do you have to say about that? Should Albertan seniors do the same, especially considering there were 3 more deaths than BC and they were all among the elderly?
We know that people over the age of 65, there's increased risk. And where the risk really increases is those individuals over the age of 80. That age group has the absolute highest risk of death from the disease. We also know that individuals who have chronic medical conditions can be at higher risk. So again, I think that my advice would be for those who are at higher risk of severe disease to think about when they're going about their daily business, how they can limit their interactions with large groups of people. It's really important that we think, all of us, about how we can support each other through means other than face-to-face interaction, especially in this particular challenging time. So in a recommendation where seniors, especially those who are over 80, think about staying home, I would also ask that family and friends of those older individuals think about ways that they can support those people and how we can all support each other. This is a time of a lot of anxiety, and so as our older Albertans and those with chronic medical conditions think about the places where they might be in greater risk, again, where there's lots of people together, I would advise that they limit their exposure to those places and think about ways that they can get connection with family and friends through other means besides being with them in person.
Dr. Hinshaw, what do you say to Alberta travelers who ignore all these restrictions and insist on traveling outside of the country during their March break next week?
So some people may have reasons for travel that are essential. I can't comment on every single situation, and some people may be in very difficult circumstances if there's perhaps a family member who's critically ill, or there's some other reason why for them, they're trying to weigh out those difficult decisions to make. But what I would say to people who are considering traveling simply for recreation, not for what I might term an essential trip or a trip with significant importance, is that they need to remember that they're not just potentially putting others at risk by maybe bringing the virus back into the country, but they're potentially putting themselves at risk as well, not just putting themselves at risk of perhaps getting sick while they're outside the country, but they may also be at risk of having severe illness. There's all sorts of changes in flight schedules these days, and so there's no guarantees that if they fly out, they may be able to return on the flight that they thought they could come back on. So really, there's lots of risk both for them personally and also that risk to all of us, because we know that the virus is spreading in many places around the world. And the best thing we can do is stay home within Alberta and take measures to prevent any further spread.
All right, we'll go to the phone and then come back. Operator, could you patch the next one through?
Our next question comes from Jennifer Lee of CBC. Your line is open.
Hi, Dr. Hinshaw. I'm wondering where you're at in terms of the idea of canceling elective surgeries in hospitals as a way to prepare for patients who may need to be treated. I know there's already a number of cases in hospital, and I know the Emergency Doctors Association of Canada is calling for that now. I'm hoping to get your thoughts on that.
So I'll maybe say, I'll maybe say Dr. Mark Joffe might be able to speak to this from the Alberta Health Services perspective.
Thank you very much. So within Alberta Health Services, we have significant contingency planning underway. We are looking at that issue as well as a number of other issues, and we'll be making decisions on a day-by-day basis so that we're ready to respond to this crisis, so that we're ready to provide health care to Albertans who will need it.
Operator, could you patch through the next question, please?
Our next question comes from Emily Keller of Everything GP. Your line is open.
Hi, I'm just wondering in regards to the case in the North Zone, do you know specifically where it is?
So what we've been saying in the last several weeks with respect to our announcement of locations is that the location of a case is relevant if it puts others at risk. So if there were community transmission associated with that case, then it would be relevant for the public to know. But otherwise, and in this particular case, it was travel related with very few contacts. So the announcements that we make by geography are about zone to protect patient confidentiality.
We'll come back to the room. Dylan, and then.
For those that have traveled within Canada but not internationally and maybe showing symptoms, if they're having difficulty getting through to 811, what would your recommendation be for them? We know that you're not supposed to call 911, or preferably not, so is there any other options out there?
Well, I would say it depends on the nature of their symptoms. So if someone's experiencing mild symptoms and they don't need urgent medical attention, then they should absolutely not call 911. If it's somebody who hasn't traveled outside the country, but as you say, perhaps to another province, and they're worried about whether or not they might have COVID, again, I do recognize that the wait times can be frustrating. Trying to call 811 outside of peak hours can sometimes help. So calling either early in the morning or potentially calling later in the evening can sometimes help to get through faster. But the other option that people might have is to potentially, again, depending what symptoms they have, if people have a family doctor, we do recommend that if someone's been traveling outside the country and they're ill, that they not go to their family doctor's office for these tests, that they go to through 811 to an assessment center if needed. But if it's been travel within the country and they're simply worried about mild symptoms, then that may be something that they want to determine whether or not they can see their family doctor for. And again, it really depends on the kinds of symptoms that they're having. But ultimately, if someone has mild symptoms, the most important thing they can do is to stay home, whether or not they have a lab test. And again, something that they can do is go on the online platform that Alberta Health Services has set up to walk through an algorithm to determine what kind of risk they may be at. Again, while there's community transmission in some parts of Canada, there's not widespread transmission all across the country. So again, just because they've traveled doesn't necessarily mean that they're at risk for COVID.
Excellent. We're going to take a couple more. Rafi?
With our elected officials.
All right, we'll do Dean and then Julia.
Maybe a question for Dr. Joffrey. Can you give us a broad sense of the state of readiness for AHS staffing? Are there supplies that you're short of or you're trying to get? Or what can you tell Albertans about where you're at?
So Alberta Health Services began our planning for COVID-19 well over a month ago. In fact, in early January, once it became evident that there was a new and emerging problem. So we have been planning extensively for over a month, planning our public health response, planning our acute care and continuing care response. We do have adequate supplies. We are training staff, ensuring that our staff are prepared for this. And again, we know that there will be more cases to come, and we are preparing for them, and we have significant contingency planning underway so that we will be prepared.
Is there a wish list you had? If you had one thing that you wish you had more of or something like that, what would it be?
More people. We've had, in fact, multiple calls today from retired nurses, retired healthcare workers in various sectors. They're calling in, they're saying, what can we do? Can we come and help? And again, as Dr. Hinshaw has repeatedly said, we're all in this together. We appreciate those calls, and we are in the process of trying to understand how we might make better utilization of volunteers and recently retired healthcare workers.
If someone's retired, can they just come back and help out then, or is there a recertification, or what would that entail?
So I can't speak specifically to the details, but certainly we're looking into that right now as we speak, and it would depend on how long they've been retired for. If they're a nurse, have they maintained their certification, for example? So we have to work through all of those processes.
CPSA as well can give you. Julia?
Dr. Hinshaw, with everything that's happened over the last few days and some pretty major developments, does the risk for Albertans still remain low, or has that changed?
So I would say the risk for Albertans can't be characterized with a simple low, medium, or high at this point. Certainly with the community transmission instances that we've seen over the last few days, there is an increased risk of exposure in the community. I don't believe it's widespread at this point. However, I think that Albertans need to be mindful of the fact that, again, we all need to be adjusting to this new normal and taking very seriously any kind of respiratory illness, making sure that we don't spread any germs to anyone else. So I think the risk of severe illness to people who are elderly, for example, those in long-term care, those with chronic medical conditions, the risk of them, should they become infected, the risk of severe illness is high. And that's why we're taking steps that we announced yesterday with respect to long-term care, putting measures in place to protect those who are most vulnerable. So again, I think it's very difficult to put a single word on it. We're beyond a low, medium, and high ranking. But the risk has increased of community transmission. And Albertans need to be mindful that the things that they do every day, the choices they make in their everyday life, can save lives. Staying home when they're sick, that can save lives.
All right, final question to
This is for, I think, Dr. Hinshaw. Just looking at shelters. When someone enters a shelter with symptoms, what is the recommendation? Should they do? And is the government preparing spaces for people who might not have somewhere to self-isolate?
So certainly the population of people who have no permanent housing is a vulnerable population. We know that many people who are in that circumstance also have medical conditions that would make them vulnerable to severe outcomes. So we have been working with community and social services and other agencies to put some health guidelines in place that should be released within the coming days to help shelters further prepare. I know that many of these locations have already done a lot of work in preparing. And so again, we are looking at the options available to government with respect to how we can help support people in these circumstances, but no decisions have been made at this time.
Excellent. Thanks for coming, guys. We will have another update tomorrow afternoon. I know these are unique circumstances with technology. Dr. Hinshaw's remarks are posted to the website, her opening remarks, so you can also get those there, and we will continue to update Albertans. Thanks for coming.